Yes, hello, I'm Kamran Abbasi, Dr. Kamran Abbasi. I'm Executive Editor of the BMJ and I'm based in London. In research in general, I think the BMJ is one of the leading research journals in healthcare in the world, one of the top 4 journals. Research is a central part of what we do. We're also one of the only journals where all our research is open access. So anybody, anywhere, can read our research papers, access them online, and we believe that's a public good and good for science and for healthcare. And importantly for healthcare, many of the topics that we publish on and the themes we publish on are very clinically orientated. So they're very relevant to people working in healthcare, to clinicians and policymakers, and ultimately they're for the benefit of patients to make people's lives healthier. Yeah, so Health in South Asia is a collection of articles on the many healthcare challenges that the region faces. But it's not only the challenges, the collection is full of solutions, advice, policies, recommendations. Because we don't just simply believe in pointing out where the issues are. We also believe in very clearly saying, here are the potential ways forward. And we do that in the collection. Why do it? Well, South Asia is a region that matters greatly to us. It's a quarter of the world's population, growing rapidly. We've had a long-standing commitment to the region. I myself worked on a similar collection of articles on South Asia in 2004. And at that time, we got together leading healthcare experts from every country in the region. And that was very exciting. Nobody had done it before. We brought them together, and between them they commissioned a series of articles. They wrote these articles, and we published them in the BMJ. And it was published to very wide success and very wide readership. Inspired by that, we thought now is the time to look back. In 2004, we asked the question, is there hope for South Asia? And of course we asked that question believing that there is hope, because we ourselves were very hopeful for the region. We believed in the talents of the people of this region, that they could overcome the healthcare challenges, the health challenges facing the population. When we looked back this time around, when we repeated the exercise, we got somebody from every country in the region. We got over 60 authors involved from across the region to write this collection of articles. Unfortunately, the message is that, yes, there has been progress, but that doesn't mean that the problems still aren't huge. There are still very large problems and challenges faced by the region, and new ones have emerged. So the issues of communicable diseases stay with South Asia, but we're increasingly seeing the problems with non-communicable diseases, diabetes, heart disease, cancer. We're seeing problems associated with urbanization, such as mental health issues, such as injuries. So the region is become, if anything, more complex, and the healthcare delivery has become more complex. So the number of issues for us to take on has actually increased. So, we asked, is there hope for South Asia? We still think there's hope for South Asia, and we believe that people in the region need to come together to focus on health, to give it high priority, because that's the way of bringing about development and prosperity for the region. So India is a readership market for us. I mean, the BMJ, if we go back historically, of course, has very strong links with India. And of course, in the UK and England, we have many doctors of Indian origin. So we cater to those readers every week, and we have done historically. But of course, India is a very important country in many ways, in the way it's developing economically, the way it's developing technologically, but also in the way that it's becoming increasingly influential in healthcare and in other areas. So focusing on South Asia and India in particular is very important to us because of the reasons I just gave you, but also because our central purpose at the BMJ is to make the world a healthier place. So that means making people healthier. And India has a very large population. And if we can help India, if we can help the clinicians in India and the policymakers in India and the other people involved in Indian healthcare delivery, if we can help these professionals improve the lives of Indian people, improve their health, we believe that will make a healthier world. So that's central to our mission. Yeah, so our future plans are that this isn't a one-off enterprise. We have a long-standing commitment in India. In fact, we've been publishing content for India and South Asia, as I said, dating back to the 1990s. We've always had an interest in this region. About 5 years ago, we started publishing more content. So if you go to the BMJ's website or if you look at the pages of the BMJ, there is more of relevance to India and South Asia. And this will continue. So this collection that we've launched is a really strong signal that we really care. We want to help the clinicians in the region, the researchers, the scientists, the policymakers. We want to give them a platform because that's something we can do. We can give people a platform to help debate issues related to health and to bring about improvements. So that's what we want to do, and we want to do that on an ongoing basis. So after this collection, we will continue to cover India. We will also plan to have ongoing collections of content relevant to this region, at least on an annual basis. Possibly we'll do it more often.